My fellow countrymen and my dear doctors, today I am very happy and proud to be an Indian doctor. I'm fed up with all these jokes in the social media about the Indian medical research, Indian doctors, Indian health system. Why to cry about it? Ask not what your country has to give you. Ask what you have to give to the country. That is most important. Today I am very proud and happy. The DRDO has successfully launched 2DG, 2-deoxyglucose, as a wonderful remedy to manage the patients who are having a hypoxic state and severe corona. Wow, Indians are brilliant. We are no less than anyone in the world. We are the first people who has introduced a lot of medical science in a scientific way ages before the West. This very important drug, the DCGI has granted an emergency use approval to the DRDO. It is 2DG. So the 2-deoxyglucose helps in a faster recovery of the hospitalized patients and reduces the oxygen dependence. The phase 3 trials for the 2DG drug were conducted at 27 COVID hospitals across the country. Now this is like Mrita Sanjeevani that Lord Hanuman has brought to wake up Lakshmana from the sleep. So basically, what is the basis of this drug? It is the dysregulated glucose metabolism in the people who have diabetes explains say increased susceptibility to the SARS-CoV-2 virus. You know, we had been listening a lot of news that those who have diabetes, those who have hypertension, they are the ones who are vulnerable. Then our medical researchers got the idea, yes, there must be some link between the dysregulated glucose metabolism and the increased susceptibility of the people to succumb to the hypoxic injury. And that brought today the 2DG. So what is the mechanism of action of this drug? Whenever monocytes are metabolically stressed, suppose you grow the monocytes in a very high glucose condition, they got metabolically stressed. So this coronavirus, it enhances the glycolysis by aberrant production of the mitochondrial reactive oxygen species. Inside the mitochondria, reactive oxygen species are being created and they enhance the glycolysis. And this enhanced glycolysis leads to activation of a transcription factor called hypoxia-inducible factor 1 alpha. And this will ensure its rapid replication. So this increased glucose metabolism through aerobic glycolysis encourages the viral replication and the cytokine production. And that ultimately compromises the T cell response and function. And it will also lead to the lung epithelial cell death. So that is the whole basis. So you can see the SARS virus, SARS-CoV-2 coronavirus, typically acts on the mitochondria. There is an impaired oxidative phosphorylation, and that will increase the reactive oxygen species. That will lead to increased HIF-1 alpha, and that in turn will increase the glycolytic enzymes, and that causes the pro-inflammatory cytokines to get excessively produced, and that lead to the T cell dysfunction and epithelial cell death. So 2DG, let us hope, is going to add to the armamentarium of all of us. Please like this video, share this video, comment this video, and subscribe to this YouTube channel. Thank you.